Hello everyone and welcome to the channel, Dissecting Your Mind. In today's video, we will talk about schizoid personality disorder. This mental ailment is suffered by 3% of the world's population, although it is estimated that there are many more people who have this disorder and who do not seek professional help or literally never get diagnosed, which can make the real prevalence higher. Schizoid disorder is characterized by a lack of interest or ability to relate to others and an apparent lack of emotion. People with this disorder tend to be introverted and prefer solitary activities. They may have difficulty establishing meaningful loving or friendly relationships and limitations in work or academic performance. It is believed that schizoid disorder may be caused by genetic, biological, and environmental factors. Defining symptoms of schizoid personality disorder may include: people living with this mental condition may have little interest in social relationships and may seem aloof or indifferent towards others. People with schizoid disorder may appear cold, flat, or indifferent in their emotional expression, which can make it difficult to connect emotionally with others. People with this disorder may have a limited range of interests and activities, preferring solitary activities or hobbies that do not involve social interaction. People with schizoid disorder may have little motivation to perform tasks or achieve goals, especially if they are not related to their personal interests. People with this disorder may have difficulty experiencing pleasure or satisfaction in daily life. Anxiety or social unrest. Although people with schizoid disorder may not seek social relationships, they may feel anxiety or discomfort in social or group situations. The most significant symptom for the diagnosis of schizoid personality disorder is a lack of interest or ability to relate to others. People with this disorder may have little interest in social relationships and may seem distant or indifferent toward others. In addition, they may appear cold, flat, or indifferent in their emotional expression, which can make it difficult to connect emotionally with others. It is often confused with schizophrenia, as both disorders share some symptoms, such as lack of interest in interpersonal relationships and apparent lack of emotion. However, schizophrenia is characterized by a severe disconnect from reality, including hallucinations and delusions. In contrast, people with schizoid disorder are usually aware of reality and can have a functional life, although they can be socially isolated. Schizoid disorder can also coexist with other personality disorders, such as equal personality disorder and schizotypal personality disorder. Importantly, people with schizoid disorder don't necessarily seek help or treatment on their own, as they may not feel like they have a problem or don't care. In some cases, intervention may occur due to a crisis, such as the loss of a job or the breakup of a relationship. It is true that it has been speculated that some famous or historical figures suffered from schizoid personality disorder due to certain characteristics of their personality and behavior. For example, it has been suggested that Emily Dickinson, the American poet, showed signs of social isolation and lack of emotional expression in her work and personal relationships. Similarly, it has been suggested that Franz Kafka, the Czech writer, had an isolated personality, an introspective writing style, which has led some to speculate that he may have suffered from schizoid disorder. On the other hand, it has been speculated that Stanley Kubrick, the famous American filmmaker, had personality traits similar to those of schizoid disorder due to his perfectionist, isolated and obsessive nature in his work. However, it is important to note that these are only guesses, and a diagnosis of schizoid disorder cannot be confirmed without a full and thorough evaluation by a trained mental health professional. It is true that treatment for schizoid disorder can be challenging, as people with this disorder may have difficulty trusting others and establishing meaningful therapeutic relationships. For this reason, cognitive behavioral therapy and psychodynamic therapy can be very helpful in working on social and emotional skills and improving the quality of life of people with this disorder. Cognitive behavioral therapy focuses on helping people identify and change negative or unhealthy patterns of thinking and behavior. For people with schizoid disorder, this may include working on social and communication skills and identifying emotions and emotional expression. In addition, psychodynamic therapy focuses on exploring unconscious patterns of thought and behavior and working on resolving underlying emotional conflicts. Both therapies can help people with schizoid disorder improve their ability to connect emotionally with others and develop social and emotional skills. In some cases, medications may also be helpful in treating depressive or anxiety symptoms associated with schizoid disorder. For example, selective serotonin reuptake inhibitors (SSRIs) are often used to treat depression and anxiety, and may be helpful for some people with schizoid disorder who also exhibit these symptoms. While it is important to seek the help of a mental health professional trained to treat schizoid disorder, there are some general tips that can help people with this disorder cope effectively. 1. Recognize your emotions. Learn to identify your emotions and express them appropriately. Therapy can help you develop these skills. 2. Practice social skills. You can work on social skills practice in safe social situations like a support group, a social skills workshop. You can also search for group activities that interest you and allow you to interact with other people. 3. Learn relaxation techniques. Relaxation techniques such as meditation, yoga, or deep breathing can help reduce the anxiety and stress associated with schizoid disorder. 4. Seek support. Find trusted people you can talk to about your concerns and feelings. Can it be friends, family, a support group, or a therapist? 5. Take care of yourself. It is important to take care of your physical and mental well-being. Eat healthy, exercise regularly, and get enough sleep. 7. Celebrate your achievements. Celebrate every achievement you've achieved, no matter how small. You can write them down in a journal or on a list to remember them. When you feel discouraged, remember that treating schizoid disorder can be challenging, but with the right help and resources, you can learn to manage your symptoms and live a full and fulfilling life. The